Hello everyone and welcome to the webinar. Today we're going to be talking about trichotillomania. I'm just going to give you a brief overview. This should be a very short webinar. I just wanted to share some information about trichotillomania because it predominantly affects teenage and adolescent girls. So what is trichotillomania exactly? Trichotillomania is considered an impulse control issue in which the individual has an overwhelming impulse to pull their own hair out. Often it begins around 12 or 13, but it can be seen as early as 9 to as late adolescence. And it can even be seen among older populations, but it's predominantly seen in preteen and teen years. It can affect men, but it mostly affects teenage girls. So that's just something to keep in mind. And something also to note is that some people want to associate trichotillomania with OCD or obsessive-compulsive disorder, but it actually falls under impulse control issues. So it goes under the same category as kleptomania or pyromania would fall under, because it's more of an issue with an impulse to do a certain behavior and feeling gratification after doing that behavior. Versus OCD, where you feel like you have to do certain rituals and certain behaviors in order to rid yourself of anxiety. And they sound like they're pretty similar, but OCD is more ritualistic, while trichotillomania is more specific and impulse related. But that's not very important to us right now. So that was just to give you a brief overview of what's the difference. But we're going to go over more signs and symptoms in just a second. So some signs and symptoms to know about trichotillomania is that it's a recurrent hair pulling that results in noticeable hair loss. It can occur on the head, on the arms, or your legs. Sometimes people even pull their eyelashes or eyebrows. So basically anywhere on your body that's hair, they want to pull it out. So that's something to note about that. So you're going to see hair loss that's not normal or related to a medical condition or another psychiatric condition. Also, something to note about the psychological aspects of this is that people feel a high sense of tension right before the hair pulling occurs and when the hair pulling is resisted. So they're going to feel really anxious, really tense, really uptight. So once the hair pulling has occurred, they get a sense of gratification, a sense of relief, and a sense of pleasure, because this has rid them of all of that tension and anxiety that they felt prior to doing the behavior. Hair pulling is often associated with being a coping mechanism and a way to soothe themselves. This could kind of be associated to some of the things that may trigger it, which we're going to go over in a little bit, but often it's triggered by a stressful event, a major life change, or even some argue that there's a biological factor to it and shifts in hormones, but for the most part, people see it as a way that people start coping with their negative feelings and their tension. So some would also say that it could fall under the category of self-harm, but just for right now, we're just going to consider it an impulse control issue. So the condition also causes extreme distress and impairment in social and occupational and education settings because people are often very ashamed of their behavior, so socially they sometimes will withdraw, sometimes they won't be as active in social outings because they're not sure when the impulse is going to all of a sudden come up. So it can be very uncomfortable for them because they're trying to hide their behavior, but they're also trying to manage the tension and the impulse they have to go perform the behavior. So that can cause them a lot of social anxiety and social distress, and also educationally. Sometimes it can impact them in that setting. So other things to note is that they're often wearing hats or wigs or bandanas to cover up their bald spots. Sometimes kids will use headbands to try and mask the fact that they have hair loss coming along their scalp. But these are just kind of mechanisms if they're pulling out hair that can be hidden. Usually, the arms and legs might be a little harder to detect, just depending on how the person is, what they're wearing, what season it is. Especially here in Indiana, there's a lot of cold months where it's very normal to wear long sleeves and long pants. So it's just something to notice, is there an abnormal behavior in their dress? Low self-esteem is also something else. A lot of time people associate this with the hair loss, so it's a consequence of the behavior versus a pre-occurring factor that has influenced the behavior. So sometimes people will feel very self-conscious about their hair loss and not feel very confident, so this could also impair them socially and occupationally. And also something the more parents will probably notice is if they find odd amounts of hair lying around the house. That isn't very explanatory from just normal hair loss that you get from brushing your hair, showering, or styling your hair, just the natural occurrence of dropping hairs here and there. So who's most at risk? For the most part, all population groups are pretty equally at risk. There's not a lot of contributing factors that all of a sudden put you at higher risk. They do notice that's predominantly among teenage and preteen girls. So definitely that's a population group that you want to watch more closely because they're more at risk to develop the disorder. Also people who have experienced a traumatic event, they've recently lost a close family member, and also that they maybe have experienced a major life change, because sometimes people associate trichotillomania as a coping mechanism, so people might turn to this to get some relief from the tension that they're feeling. Also, people who have a family history of trichotillomania are at a slightly increased risk of developing the disorder themselves. To learn some more, these are some websites. A couple of these are just resources where you can go learn some basics and also to offer some treatment options. And this one right here is actually a link to a video on trichotillomania, and it just explains the condition a little bit more if you want to learn some more information. It's a link to a YouTube channel. It's actually by a licensed marriage and family therapist. She has a lot of great information about mental health issues that predominantly affect women and teenage girls. So I'd really encourage you to go check her out. She's got lots of stuff on self-harm and suicide and depression, eating disorders, a whole works of different things that affect teenage girls and how treatment options are available and what to look for. So I encourage you to go check her out. If you want to learn more about this, you can go check out these links, and also feel free to talk to mental health care providers in your own community about trichotillomania, what options are available, and just do your own Google search. There's lots of stuff on the internet to look at, so I encourage you to do your own research. Thanks for listening.